A new study by UCSF shows a simple way to lose those extra pandemic pounds. Dr. Ashley Mason is the first author of that study. Great to see you. First, let's talk about how much weight the average American has gained during the pandemic and what factors are involved here.
Well, that's a really complicated question, and so I'm going to give you a complicated answer. People have gained varying amounts of weight during this pandemic. Some folks have lost weight, some folks have stayed the same, some folks have gained weight. And what we really found in this study that we just published is that what is around you in terms of food and beverages really might impact what you're actually consuming. In that study, what we found was when we took sugar sweetened beverages out of the workplace, people drank less of them. And what we know is that those sugar sweetened beverages, they have a lot of calories in them and a lot of sugar in them. And if those are just sitting around in our houses and we're here all day working from home, you can probably bet that we might be likely to overconsume them.
Yeah, it's happened in my household for sure. And earlier research showed just how much added sugar comes from those sugary drinks. Tell us about that study.
There's a bunch of different studies that have shown that these beverages have upwards of 40 grams in a single serving of sugar. And that's a lot of added sugar, considering that we shouldn't be having ideally more than 25 grams a day. So even just consuming one or two of these sugar sweetened beverages can put us over that limit. And that doesn't even take into account all of the rest of the food that we're eating during the day. So these beverages can really set us up to be drinking a lot more sugar than we should be to be healthy.
And now tell us about this new study and how some intervention helped out.
Yeah. So what was really exciting about this study was that at UCSF, we banned the sale of sugar-sweetened beverages throughout the campus. And a subset of these participants who we recruited to give us their self-reports about their experience were also randomized to receive a brief motivational intervention or not. This was only about a 10-minute intervention, and they really learned in this intervention about how much sugar is actually in these beverages. It's easy to ignore how much sugar is really in these beverages, but when you look at it in terms of sugar cubes, actual stacks of sugar cubes that represent how much sugar is in a drink, for example, it can really be illuminating. And what we found in this study is that for people who said they really, really crave these sugar-sweetened beverages, if they got that intervention, that brief 10-minute intervention that really talked about how much sugar was in these drinks and what those associations with health are, those folks really reduced their intake of sugar-sweetened beverages relative to the people who didn't actually get that brief 10-minute intervention. Importantly, everybody reduced their consumption of sugar-sweetened beverages. There was a very strong main effect of just getting these beverages out of the way so that they weren't so easy to get. People drank less of them.
And how much of a difference can that make, getting rid of those sugary drinks from your household and from your diet?
It can make a huge difference on your health, both in terms of your waistline and your metabolic health in general, your diabetes risk, and your risk for other metabolic disease-related problems. So not to mention the added dental effects. We know that sugar isn't good for teeth. So there's a wide range of benefits that you can have by removing these beverages from your diet. And a really great step to doing that is just getting them out of your house. If you don't have a soda in your house at 2 a.m., you can't drink it when you wake up in the middle of the night, right? So it's one thing to have these beverages as a treat when you're outside of your house, but keeping them in your house really regularizes drinking them, and that's really not something you want to do.
Okay, so water is the key, and you've given me something for my to-do list as soon as I get off of work today. Dr. Ashley Mason with UCSF, thank you so much for your time and your expertise. We appreciate it.
Great to be here.